Let's talk to Richard Heydarian, a political scientist based in Manila. He's also the author of The Rise of Duterte, a populist revolt against elite democracy. Thank you very much, Richard, for joining us. At the beginning of the pandemic, President Duterte said that the virus would die a natural death. What is his attitude now?
Well, if you look across the world, populists of different stripes have not done very well. So either they're overlooking the worst cases in the world, Donald Trump or Bolsonaro of Brazil, or the worst cases in specific regions, whether it's Turkey, whether it's Philippines, Indonesia, or India, among others. But in case of President Duterte, in fairness to him, he really started quite dismissive with respect to the nature of the threat of the pandemic. He was resisting imposition of travel restrictions on China, where the epidemic came from, of course, because of his close relations with China. But around middle of March, he began to sing to a totally different tune. So if you look at it over the past 3 months, the Philippines has had one of the longest and strictest lockdown in the world. And according to the International Monetary Fund, at one point, 75% of economic activity was actually shut down. So he did quite a reversal, 180-degree shift there. The problem, though, is that even though the lockdown has been very strict, it has been hemorrhaging the economy already, and recovery is one of the weakest in the region in the third quarter. There's also not much evidence that the government is getting the public health aspect of the crisis under control. The Philippines has one of the worst cases of new surges of COVID-19 infections. Fatality rates are among the worst in the region, and the recovery rates are also not too encouraging. So the Philippines is facing the double whammy of public health crisis and also the economic crisis.
And despite all of this, despite the pandemic, despite the lockdown, from listening to his State of the Union address, he's trying to, make it seem like business as usual, especially when it comes to cracking down on drug offenders.
Yeah, this is a problem we see. I mean, in fairness to President Duterte, we saw a visibly exhausted, more enervated version of him. He seemed more deflated than in the past when he had approval ratings of 70-80% net. I doubt his numbers are anywhere as high, although for some strange reason, approval ratings are not coming out by survey agencies. Many people are also criticizing the government for supposedly using the emergency situation for a so-called medical coup, or push for what I've called an authoritarian blitzkrieg. I mean, just after imposition of emergency powers and emergency situation in the Philippines in middle of March, you have subpoenas against dozens of netizens accused of spreading misinformation on quite the unsubstantiated grounds. You had the shuttering of the country's biggest media network. You had the controversial conviction of Maria Ressa, one of the leading journalists in the Philippines, and of course that draconian anti-terror bill. And by the way, just days before this SONA, State of the Nation address, the government came out with an advisory saying that public protests are not kind of allowed because they could undermine public health situation, even though we saw in the case of the United States, protests across 2,000 cities did not really lead to much increase in epidemic outbreaks. So the fear here is that the president is very much business as usual. In fact, if anything, it's a blitzkrieg when it comes to consolidation of power and shuttering of the opposition. But when it comes to economic recovery, we're still to see a single stimulus package from the government, a consolidated one, 4 months into this crisis. And when it comes to the public health aspect, the government is still playing a catch-up. Even the president himself had to admit they started quite slow on mass testing. Even on contact tracing, they got criticism from the World Health Organizations. And when it comes to new cases and the surge in epidemic cases, it's not the most encouraging situation. So this is crucial because in a year from now, the Philippines' next presidential elections is going to effectively start. So this is going to also influence the president's ability to shape the outcome
of the next election. Richard, always fascinating to talk to you. Thank you very much for joining us here on the program.